Meantime, President-elect Donald Trump has made all of his picks for the health-related team. And joining us right now to talk about all of this and what it means to the sector is Dr. Scott Gottlieb. Of course, he is the former FDA commissioner under the last Trump administration. He's also a CNBC contributor. And Scott, you're still a board member at Pfizer as well?
That's right.
Okay, and a board member at Pfizer. Let's jump into this. And why don't we start with the incoming administration's choices? Because there's been a lot of consternation, a lot of people who have said, wait a second, with RFK Jr. heading things up. What do you say as somebody who served in the last Trump administration?
Yeah, look, well, I have deep concerns about Kennedy's stated intentions to roll back core public health protections, particularly as it relates to childhood vaccines. He's brought in a very experienced team, a lot of lawyers from the Children's Defense Fund, which is his anti-vax organization. These guys are capable. I think they're deadly serious. They've been very clear about their intentions. And I think sometimes you have to take people at their word. And just to sort of level set where we are right now, we had 5,000 cases of pertussis last year. We're going to have 30,000 cases this year. Pregnant women, for the first time in a very long time, now need to think about pertussis as a risk during pregnancy. And if you look at vaccination rates for MMR, there's states that really are at the tipping point in terms of reduced vaccination rates. Herd immunity is achieved at a level of about 95% coverage. If you look at Idaho, it's at 79%. You look at Alaska and Wisconsin, 84%. Minnesota, 87%. Florida, Colorado, Oklahoma, Georgia, and Utah at 88%. When I was at FDA in 2018, 2019, all those states were in the low 90s. If we lose another 5%, we're going to be in a position where we see distributed outbreaks of measles, and that could easily happen in the next few years.
MMR, measles, mumps, rubella, pertussis is whooping cough?
Whooping cough.
So you're a physician. What do you worry about? What do you see?
Well, what I worry about is that we're at a tipping point where we're going to start to see epidemics of diseases that have long been vanquished. And God forbid we see polio reemerge in this country. This could happen in the next 4 years, especially with MMR. The measles vaccination rates have dipped to a point where we're at a tipping point right now. Another 5% down and we'll be there.
So you're saying people are going to die because of this?
No, but you warned about this. When you were at the FDA, you said because of vaccine hesitancy in this country, because of concerns about the COVID vaccine, you worried about what that would mean for all of these other related diseases and the vaccines that we have.
Well,
which vaccines should we be getting, which should we not? Because RFK Jr. has softened his stance. If you go back and look at what he said back to 2013, he talked about how vaccinating children and trying to cover up any problems from it he likened it to abuse by the Catholic Church, sexual abuse of children. He said that what the CDC was doing in 2019 with COVID vaccines was vaccine. He's talked about jailing vaccine scientists in the past. Now he sounds a little less strident in some of the comments that he's making, but you don't believe his
Well, I don't think he's less strident. Look, this is a post-COVID environment, no question about it. And I was against the mandates. We talked about this on this show. I was against the COVID vaccine mandates because I worried that it would breed vaccine hesitancy. I think what you're seeing now is people coming into the political spectrum preying on that. And they're deadly serious about the policies they're going to implement. So what could RFK do? And he's committed to this. You know, he's committed decades of his life to this. He's not going to back away. They could disband ACIP, the advisory committee to the CDC, and issue new recommendations that are non-binding to states, giving states cover to move away from the childhood immunization schedule. They could frustrate the Vaccines for Children's Fund, which vaccinates 50% of all kids in the country. Basically, for example, tying states that want to use that money to vaccinate kids to certain reporting requirements, like reporting on immigration status or religious status for children. Those are easy things they could do administratively, and that would make it very hard for states to take the money. I'm not laying out their roadmap. They know their roadmap, and this is their roadmap. I've been in policy. I know what these agencies can do, and I know what they intend to do. These are very serious people. He is smart, and his team is very capable around him.